My next two guests are coming from Fort Worth, Texas. You already heard Dr. Guiteau, who is a transplant abdominal surgeon, and Dr. Green. Get lean with Dr. Green. We also heard the powerful story from Deborah Little, who received a kidney transplant in 2020. And now we're bringing both of the doctors out on the Brandon Holt Show to get a word on what this process is like. Hey, let's bring back Dr. Guiteau. Doc, good to see you.
Good to see you again.
You as
Nice to see you, Dr. Green, as well.
Oh, man. So we got Get Lean with Dr. Green. We have to come up with a name for Dr. Guiteau. We're going to work on that over the next couple of days. A title. So guys, let's jump right into it. First, let's talk about what were your thoughts on the powerful testimony of the young lady who overcame transplant surgery?
I think it's an amazing story. I think she really highlights the success that can be achieved through transplantation. I think when you look at what her life was like before transplant, you were able to see that she has been able to not only improve her quality of life from no longer having to be on dialysis to quantity of life as well. Because what we say on average is that once you get transplanted, it increases your length of life by double what it would have been if you stayed on dialysis.
And Dr. Green, I noticed how she was talking about the waiting list, how she had to wait for 3 years before she actually received the phone call. And you guys talk a lot about the barriers to obesity as it relates to transplantation. Can you guys kind of elaborate on that?
Yeah, so, in my spectrum, in my space, when you look at most transplant centers are reluctant to transplant patients that have that body mass index over 40 because it's been known to have increased operative times, increased infection rates, and also even potentially graft failure. And so when you look at the combination of the inherent risk that the larger BMIs have, they tend to get overlooked disproportionately. And so I think that as you begin to understand obesity as a barrier to why some individuals with a lot of healthcare problems may get overlooked in that process.
I agree with Dr. Green. I think when you look at obesity as a barrier, specifically to kidney transplant, we're looking at increased risk of bleeding, complications immediately post-surgery, complications even involving recurrence of diabetes as a #1 cause of kidney disease after you get transplanted. And so when we have our patients who have a BMI of even 35, we're talking about sending them to Dr. Green because of all the health benefits that come from getting bariatric surgery in terms of their general health, but also their success after transplant.
So you mentioned that diabetes is one of the leading risks of the disease. Can you elaborate on that?
Yeah, absolutely. I think so. Diabetes is the #1 cause of kidney disease by far, and then #2, hypertension. And a lot of times they come together. And as Dr. Green has mentioned, the major risk factor for diabetes in the United States is obesity, and that has to do with a lot of the physiology of obesity and inflammation that Dr. Green mentioned. And so patients who are obese are at risk for developing diabetes. And then, of course, the diabetes very much leads on into end-stage renal disease. And so we all are really at different points playing a huge part in the health of these patients and their ability to develop end-stage renal disease and need a kidney transplant.
Now, Dr. Green, is it common to operate on young children who are obese? And Dr. Guiteau, is it common to do a transplantation procedure on a young child?
So when you start getting into childhood obesity, I would say surgery is not the first line from the standpoint that now as we look at centers of excellence, they're designating different institutions to which children should be operated on. There's a whole psychological component that I feel that children need to go through to make sure that they are mentally prepared to deal with the issues surrounding surgical responsibilities, post-operative eating, and exercise. And so we don't at our facility treat minors, but there are probably a few centers throughout the country that might treat kids from a surgical perspective, that is.
And when you look at pediatric transplantation, the gambit of disease processes that cause kidney failure in our pediatric population are a little different than what are caused in kidney failure in our adults. A lot of what we look at can be the culmination of genetic disposition and lifestyle factors that affect our adults, whereas children may have more genetic problems that may lead to end-stage renal disease and needing to then get transplanted. We definitely do kidney transplants on pediatric children, but not at our center. But it's definitely not for the same reasons.
So you all have two very successful and powerful programs in the Fort Worth area. How do your programs complement one another?
Well, I think it's a symbiotic relationship, bridging from the fact that when his patients are in end-stage renal disease and they're overweight, adding a surgical tool to help manage that weight before they get transplanted is just another added benefit to the program. And by the nature of us being housed in the same institution, it leads toward a great communication. And I think that therein lies the best, when you have physicians being able to talk, being able to have programs that would mirror the outcomes, because now you have that interface about the best incomes for the patient.
Okay. Dr. Guiteau?
Yeah, Dr. Green, we've essentially set up a pipeline of patients that when they come to see us in our clinic, like Dr. Green mentioned, there are some transplant centers who won't even see patients with BMIs of 40 or above. And what we've done is we've developed a weight management program where we say, come bring all of your patients, regardless of BMI, to our center. They'll be seen by our surgeon and our dietitian, and we will do a direct referral to Dr. Green services, so that we can help to expedite their ability to get listed. Because we all know that the most difficult thing we ask anyone to do is to lose weight, let alone a patient who has end-stage renal disease. And so by putting this program and having our symbiotic relationship between our two programs, we really hope to affect change in the sense that we want to get people who will do well with transplant otherwise the tools that they need to get to the weight they need to get to in order to be eligible for transplant.
I think also, Brandon, just to mention that it keeps patients engaged. I mean, the daunting task of saying I have to lose weight, or the daunting task of saying, oh, you're not a candidate because of your weight. I mean, I think it can be a Debbie Downer. And so realizing that, come on, come on, we're going to do it safely, we're going to do it effectively, and therefore therein lies the best outcomes. And then you have the best of both worlds, because our follow-up too is of most importance. You have the follow-up from the transplant side, but also the bariatric side. And my viewpoint is, when you leave my office, you have a follow-up appointment. And so I think that's the key for long-term success, is that follow-up as well.
Dr. Guiteau, somebody just received the word this morning on a doctor's visit that they have to have a transplant. Their mind is all over the place. They're stressed. They're worried. They're in fear of their life. What can you say to that person, and what can you say to the individual who's been on the list for several years and they just feel like all hope is gone? Why even continue?
I would say that there are a lot of emotions going through both of those patients' heads. I think take a step back, take a deep breath in, and realize that these are things that we deal with every single day, and that there are people who are there to answer questions and to help calm them down. The most important thing for the person who is just being diagnosed with end-stage renal disease and that they may need to get transplanted is that transplant is a very long process, but it is a very organized process, in that we have coordinators who will walk you through every single step of the process to make sure you get everything you need done in a timely way in order to get listed for transplant. And we will follow up with you every single year until you get transplanted, to make sure that you continue to take care of yourself in terms of your medical care up until the point you get transplanted. For the patient that's been waiting for a long time on transplant list, I say the fastest way to get transplanted is to get a live donor. And not only is living donation the fastest way to get transplanted, it is the most effective and the most successful way to get transplanted. A deceased donor kidney transplant coming from someone who passes away lasts on average 7 to 10 years. A live donor transplant lasts on average 15 to 20 years. The other beautiful thing about a live donor transplant is that as soon as you have a donor, we can schedule your surgery within within 4 to 8 weeks.
So let's go back. So you said a deceased transplant donor, that organ has a lifespan of how many years?
7 to 10 years on average.
And what
So
happens
averages are great for large groups of people, but they're horrible for individuals.
now, what happens after that 7 to 10 years?
You know, so a lot of our patients develop chronic rejection, and that is a combination of the effects of the medications. The medications we use to protect your kidney from your body have the side effect of damaging your kidneys.
Mm.
So it's a combination of those medications damaging the kidneys, as well as a process that we do not fully understand, where there's just a large amount of chronic small hits to the kidneys that lead to eventual rejection and fibrosis of the transplant kidney, where it actually will fail.
So they will need another transplant.
A lot of times, if you get transplanted at a very young age, you may need another transplant. But I will also say that I have had people who come into my office who've had their deceased donor kidney transplant for 30 plus years.
Wow.
The thing is, we can never know which one any patient will be. I say you control what you can control and let the rest in his hands.
And Dr. Green, is there a lifespan on weight loss surgery as well as a kidney from a deceased donor as opposed to a living donor? Or is there a lifespan on how effective the procedure will last?
How long a weight loss procedure will last for a patient?
Mm-hmm.
So we define success by maintaining and losing at least 50% or more of your excess ideal body weight and keeping it off for 5 years. Now, there's a variability to that, but you know, there's studies that suggest even 10 to 14 years out, people will be able to maintain that level of success. But it goes back to what you do with the tool you have. Healthy eating, exercise are always going to be paramount in long-term success. But there may be individuals that may gain weight back over time. But if they're honest with themselves, the key component that happens is the induction, the increase in carbs. And that's what happens.
Well, Doc, I just got to close out with this, guys. Dr. Green, I'm guilty. Dr. Guiteau, I'm guilty. But I'm doing better, though. Let's talk about COVID-19 all-time high. The vaccine is out.
Yeah.
Matter of fact, that's a question maybe for next time. What are your thoughts on the vaccine? But a lot of people are trading off right now. You know, I'm exercising 2 hours a day, knocking out that triple cheeseburger at nighttime. Tomorrow I'm back in the gym, and they're just constantly trading off. And in their mind, they're telling themselves, at least I'm exercising, but they're not seeing any outcome. They're not seeing any benefits externally. So what can you say to the person who's struggling with the trade-off right now?
Well, I mean, clearly, I think that you have to look at the calories consumed. You know, I have a simple equation that I talk about. Energy in is greater than energy out. You gain weight, and the energy in is the calories you consume. And so, if you're not going to put in the same level of energy, and the sad thing is, you have to burn more than what you consume. Your body has innate metabolism that you burn every given day. Like right now, we're burning calories. Now, we're not burning as much as we would if we're out running because our body always needs a fuel source. And so you have to just face the reality of doing something different in your life to get a different outcome. Because doing the same thing over and over, trying to get the same outcome or different is insanity.
That's right.
Yeah.
Dr. Guiteau, did you have any final words?
No, I agree. I think when you look at, and it goes to our patients, it's very difficult to get people to lose weight, even with a strict diet and exercise. And for those patients who have the ability to come into the transplant office if they need a kidney transplant, know that we do have some resources and tools through people like Dr. Green to help you lose weight, and not only lose weight, but keep the weight off, which I think is something that's also very difficult to do.
Gentlemen, I appreciate you coming on. You've been a great benefit to the show. Hope to have you back, Dr. Guiteau. Your word was right on time. Dr. Green, get lean with Dr. Green.
Hey,
everybody,
thank you, Brandon.
No problem.
Thank you very much for having me on. I'd love to come back.
No
hey,
problem.
take care, Jack. See y'all around.
Hey,
Yeah, certainly. Good to see you.
God bless.
We have to go to commercial, but guess what? We'll be right back.